good day, viewer. I'm Dr. Joachim Ufoma, a medical practitioner with Pet Hospital Limited. Today, I will be discussing BPH. BPH is a condition that's very common these days. In my practice, there's no week I don't see a patient presenting with urinary retention. So, I want to enlighten the public, general public, what BPH is and all that. So BPH is simply a benign prostatic hyperplasia. It is a condition found in men, and I just want to tell us about the simple anatomy of the prostate. The prostate is a sexual organ located at the base of the urinary bladder and is wrapped around the ureter. As from 51 to 60 years of age, it gets enlarged. What is causing the enlargement? Some people may wonder, they begin to ask, what is causing? There are several studies that have been conducted, and the most recent one shows that the male hormone testosterone, when the man is elderly age, he gets converted to dihydrotestosterone by a hormone called 5-alpha reductase. And the dihydrotestosterone is what stimulates the prostate to enlarge. And the enlargement of the prostate is inward. Once it enlarges inward, it compresses the ureter, thereby blocking the flow of the urine. That's why most women, they present with inability to pass urine and all that. Now, what is the presentation? What are the symptoms? Most of the symptoms we see are weak, difficulty in starting the urination, weak urine stream, urinary urgency, and frequency. Those are the presentations. There's oftentimes they present with dysuria, painful urination. Now, how do you make the diagnosis of this condition? The diagnosis is made at the clinic, and we do digital rectal examination. We examine the prostate through the rectum, and you notice some enlargement. Other investigations that are carried out are the prostate scan. The prostate scan will reveal the enlargement of the prostate. We also do a blood test, PSA. It shouldn't be more than 4 nanogram, but once it's above, extremely elevated, it's suspicious of cancer. And what we notice that is cancerous, the other tests we can do to rule out cancer. So those are the tests we usually do basically. Then the treatment is 2 methods. We have drugs and surgery. The drug treatment is we use a drug that inhibits the actions of the 5-alpha reductase. We call it a 5-alpha reductase inhibitors. The finasteride. There are a lot of them. Then we also use alpha blockers, the tamsuline that helps the urine to flow. Those are basically the management. Then we also have other products that helps to reduce the enlargement of the prostate. There is a study that just conducted. It said tomato has some element that also help to shrink some herbal products, but what we use basically in those drugs. Pet Hospital is offering a free medical check where we check the male elderly for prostate. We'll be doing the digital examination, PSA, prostate scan, to be able to prevent this BPA, acute urinary retention. So we want the general public to come and have their prostate checked.